Hi, good morning, everyone. Today, we are going to deal the topic goals in psychology, goals in health psychology. So, what are the previous classes we have gone through the introduction part of health psychology, and we have came to know that the need and significance of health psychology. So, today we are going to deal with the next topic, that is goals in health psychology. Yes, there are mainly five main goals for health psychology. So, this part that we have already discussed in the first part, that is in the introduction part itself, we have go through these goals of health psychology. But here we are going to discuss it once more again. That is, it is an important part in the health psychology. So the first one is to prevent illness, and second one to promote good mental health or good health, to help with the treatment of illness, and the fourth one to investigate the psychological correlates of illness, and the fifth one is to improve the healthcare system and health policies. Yes, the first one is to prevent the illness. So, from that word, it is clear that prevention is better than cure. So, to prevent the illness, the health psychologists what they have doing or what they are doing. So, the health psychologists have argued strongly that it is better to prevent an illness than to cure it once it has occurred. So, this is the area that health psychologist works. So, they are trying to not to get the illness, and they arguing that it is better to uh, prevent an illness than to cure. So it is the motto of these health psychologists. And the role of psychologists in preventing illness is to develop an understanding of how mental states can influence health behavior. And the other thing that is the role and the other thing that is the role of this psychologist in preventing illness, what they are doing is to develop an understanding of how mental states can influence the health behavior. So here we can see a example that if we wish to stop people doing things that are bad for their health, we have to understand why they do these things in the first place. So in the other areas, like in the physical physicians area, so if we go with some of the illness, they will just treat, they will just give the medicine, and they will just give the medicine, and they will instruct you how to follow. This is the thing what we are getting. But when it comes into the case of an health psychologist or in the health psychology, that we they will try to understand why these are happening, or why it is being happening. That is the that they will put in the first place, and after that only they will go with the counseling sessions or some other areas or psychotherapies or whatever the things being done in the area of psychology or counseling. These all things will be happen after that. So they will go into the backside of understanding the causes and why it is being done. So this is the area of called to prevent the illness. Yes, the other important goal of an health psychology, that is to promote good health. So not only the area of mental health but also the physical health. So because the health psychologists see health as being more than just the absence of disease, they are interested in actively promoting well-being, that is mental well-being. So they think that, as we have discussed in the previous point, that when we get an illness and when we consult with an doctor, they will be knowing about, or they will be just look into, mostly they will just look into the physical area than the mental well-being of that person. So health psychologists see both the cases, they just not consider the absence of disease with their health, but they'll be actively promoting the mental health of the person itself, and it will lead into the well-being of that person, or well-being of the people. A health psychologist would suggest that it is always possible to increase your level of physical and mental well-being. So that is, we already discussed, that is not only the physical area, and there will be increase both way, that is the physical and mental well-being. So these two comes together. When the absence of illness to the body, it does not mean that the person is in the healthy manner. So uh, the promotion of mental health is also important, and then only we will be call it as a good healthy person. So it will lead into the mental well-being also. Yes, the other goal of health psychology is to help with the treatment of illness. So in the previous 2 points we have discussed some of the points, like in the first area, that is to prevent the illness, and the other one is to promote the good health also. So when it comes here, that is to prevent with the treatment of illness, these two will be having the role here. That is, in the first case we already discussed about the prevention, but here what happens is the person is already with the illness, and we have to taken care of the person who are already having illness and undergoing the treatment process. So despite preventive measures, people do fall ill, and health psychologists have a good role in developing treatments that take psychological aspects into account. So the treatment will be going on with the physicians, but there will be some of the psychological consideration should be there, or it should also consider into the account of that patient. So what is happening? So for an example, a doctor may treat a heart patient using drugs or surgery, but a health psychologist could contribute to the treatment by introducing a stress management program. So this is what happens within the uh, treatment of illness. So even though the person is under some uh, illness and undergoing some of the treatment process, so an example is given that the patient is undergoing a heart problem, and they are using some of the doctor or the physician is using some of the drugs or surgery. So in the case of health psychologists, they will be using, or they will be introducing some of these stress management techniques or stress management program to the patient or to the client, that is to help with the treatment of illness what he or she is taken care. The other goal of health psychology is to investigate the psychological correlates of illness. So what is the relations of illness with the psychological concepts also? To understand this, the health psychologists are being used, or it can be considered as the goal of health psychology. So this is a vital aspect of the work of health psychologist. Why it is being done? That it involves carrying out researches to find out which specific mental states are linked to which physical diseases. So what are the specific one which are the mental, which are the specific mental states, or what are the mental states which are linking to the physical diseases? So there will be some reason for that. There will be some reasons which exist for some of the physical diseases. It can be done from some of the there should be some psychological factors which leads to some of the physical diseases, or to understand that. So for example, the knowledge that stress is linked to high blood pressure can enable practitioners to identify people at risk as early as possible. So there will be when with an problem, that is the high blood pressure, so automatically the reason, one of the reason will be the stress can be linked to that. The other it is a psychological variable. Stress can be a reason. Sometimes stress can be a reason for getting into high blood pressure. Okay, so to understand, and it will help, and it will uh, help and identify the people at risk, and this can be lead to a better treatment can be done with that client or with that patient. So that is the role of health psychology in the case of psychological correlation of illness. So this is the another important area, that is to improve the healthcare system and health policies. So that we know that the current situation, what are the role for the health psychologist, and that is the knowledge gained by health psychologists and their general approach to health and illness can inform the people who run the healthcare system and help them to provide a more effective service. So they'll be getting some of the knowledge or some of the information through the research areas, and the approach to health and illness can inform the people or to the authority, like the current situation, that is it will be informed to the health department, and they'll be informing, or they'll be saying how to, they'll informing the authority to how to run the situation and how to taken care the health of people or healthcare system, how they have to perform, and these all thing will be done from the side of the health psychologist, and it helps them, it helps the authority, or it helps the system, or it helps the clinics or some other hospitals. They'll be they'll help them to provide more effective services in the area of disease or problems. So this is the role of an health psychologist in the case of to improve the healthcare system and to develop some of the health policies with the health department or health system.